Hello friends, I'm Dr. Shruti and welcome once again to Dr. Shruti's channel. A channel to help you stay healthy and stay happy. In this channel, I upload videos every week related to health, diet, nutrition, healthy cooking and much more. In today's video, we'll be discussing about the earliest symptom of pregnancy, and towards the end of the video, I'll also be telling you which is the most easiest, most convenient and which is the most specific test for the confirmation of diagnosis of pregnancy. If you're new into this channel and have still not subscribed into my channel, then do press on the subscribe button. After subscribing into my channel, do remember to press in the bell button by the side of the subscribe option so that you'll get regular notifications about my regular video uploads. So friends, without any ado, let's get started now. The first symptom is of course the delay in periods or the amenorrhea as it is commonly known in our medical terminology. In the reproductive life of a normally healthy menstruating woman, that is a healthy sexually active woman who is menstruating at regular intervals, if she experiences a delay in periods or amenorrhea period, then the first and foremost diagnosis that comes to the mind of a clinician is of course pregnancy. But of course this needs to be corroborated by further investigations like the urine pregnancy test or the ultrasonography, about which we will be discussing in detail in the later part of this video. The second commonest symptom, the earliest commonest symptom of pregnancy, as it is very commonly seen in all the TV soaps and the movies throughout the years, is of course the nausea or the vomiting or the morning sickness, as it is very commonly known. Now the term morning sickness implies that most of the females experience nausea or the vomiting sensation during the early morning hours, but at times it might be spread out throughout the day, and throughout the day in the course of 24 hours, the pregnant female might be experiencing nausea or vomiting. It is very important over here to remember that nausea and vomiting is very common in those females who are pregnant for the first time, and it usually takes place during the course of the first 3 months of pregnancy, and in most of the cases it subsides by the end of the 3 months. But in a certain small percentage of females, the nausea and vomiting might persist for the whole 9 months. Talking personally about my personal experience throughout the course of this two pregnancies that I experienced, throughout the course of both the pregnancies, I had vomitings umpteen number of times throughout the day for the course of the whole 9 months, in spite of the regular intake of the best of medications. And as doctors put it, that the nausea vomiting, it has a switch on and a switch off mechanism. That is, as soon as you get pregnant, you start having nausea and vomiting, and sometimes as I said, it takes place throughout the course of 9 months, and as soon as the baby is born, then the vomiting subsides of its own. But the point to be relieved over here is that in most of the cases it subsides by the end of 3 months, and then you do not experience nausea and vomiting. But of course it is one of the earliest symptoms of pregnancy. The next earliest symptom of the pregnancy is the change in appetite or food habits. I will say the change in appetite because in most of the cases there is a loss of appetite due to the nausea and the vomiting sensation. The woman is not able to tolerate the smell of certain types of foods, and there is a change in the food preferences. She might prefer to have certain foods, she might not prefer to even have a smell or sight of certain foods. So most of the cases there is loss of appetite, but at times the appetite is increased. But this feeling of the loss of appetite usually subsides by the end of 3 months, and from the 4th month onwards, there is usually increase in the appetite, and the nausea and vomiting also subsides by the end of the 3rd month. The next symptom is of course the weakness and lethargy, and it is usually associated with the loss of appetite. The woman is experiencing nausea and vomiting, eating less, and then she experiences weakness and lethargy. But again, as I told you, it usually subsides by the end of the 3rd month. So nausea, vomiting, loss of appetite, change in food preferences, and then the weakness and lethargy, all these symptoms, these are one of the earliest symptoms of pregnancy, and they usually subside by the end of the 3rd month. Coming to the next symptom of pregnancy, it is very troublesome for certain females. It is the increased frequency of urination or micturition. That is, you need to go to the loo or washroom a number of times, and this is due to the pressure on the urinary bladder by the enlarging size of the uterus. Now, this increased frequency of urination or micturition, it is usually present in the first few months of pregnancy. It subsides in the 4th, 5th and 6th month, and then again towards the end of the pregnancy, you again start experiencing this increased frequency of urination. Coming to the last and the earliest symptom of pregnancy, the breast changes. Usually in both the breasts, there is a feeling of heaviness, and the nipple and the areola area, it might turn into darkish in color or dark blackish in color, and there might also be a certain amount, a small amount of milk discharge from both the nipples. But these breast changes are usually very much evident in those females who are pregnant for the very first time. So friends, this was all about the earliest symptoms of pregnancy. But as I told in the very starting of the video itself, all these symptoms need to be corroborated further. We need to arrive at a conclusive diagnosis of the confirmation of pregnancy only by means of certain tests which can confirm the pregnancy. So now, which is the easiest, which is the most convenient, and which is the most specific test for the diagnosis of pregnancy? Let's find out. Talking about the urine pregnancy test, it is the easiest, most convenient and most economical. That is, it is the least expensive test for the diagnosis of pregnancy. As soon as you miss your periods, within the 2 days of the missing of your periods, you can do the urine pregnancy test with the help of a kit which is very easily available in the market. It is very cheap at the cost of hardly 60 to 70 rupees, and you can do it in the privacy of your own home itself. And for the use of urine pregnancy test kit, it is advisable to use the first morning sample of urine, and the urine pregnancy test, it is based on the detection of the anti-HCG human chorionic gonadotropin present in the urine of a pregnant female. And this human chorionic gonadotropin, or HCG as it is known in the medical terminology, it is present in the highest quantity in the first morning sample of urine. So it is advisable to use the first morning sample of urine for the detection of your pregnancy by the means of urine pregnancy test kit at home. But of course, it can be done at any time of the day because the HCG will be present in the urine. But most advisable is in the early morning hours. I have already uploaded a separate video on how to do a pregnancy test very easily at your home. It is very easily available on my channel. You can have a look at it, and I'll leave a link in the description box also. Just to make a quick revision of it, if you see two dark pinkish lines, one C or control line and the other T or test line, then it is diagnostic of the pregnancy, two dark pinkish lines. But if one line, that is the C or control line, is dark pinkish while the other line, the T or test line, is slightly pinkish, then it is termed as weakly positive, and in such a case you should immediately report to your doctor or gynecologist, because this might be indicative of the ectopic pregnancy, which might prove dangerous for the pregnant female. And if only the C or the control test line is positive, then it is indicated that the urine pregnancy test is not positive, that is, it is negative and the woman is not pregnant. This was the easiest, the most convenient and the most economical test, the urine pregnancy test. But for the specific diagnosis, for the confirmation of pregnancy, the test that is advised by the doctor or gynecologist is of course the ultrasonography. The ultrasonography can be done as early as 8 to 10 days after the missed period, but it is usually advisable to undergo the ultrasound examination or the ultrasonography test about the 6 to 8 weeks of pregnancy, because the fetal heartbeat can be heard as early as 6 weeks of pregnancy, and then the doctor can tell you conclusively that yes, you are pregnant and the baby is fine. It is very important to undergo the ultrasound examination within the first 3 months of pregnancy, because then you come to know about the size of the baby, how much the baby is growing, the position of the fetus, whether it is inside the uterus, whether it is safe or not. So very necessary to do the ultrasound in the course of first 3 months of pregnancy. Very soon I'll be uploading the video on the ultrasound in pregnancy, whether the ultrasound should be done in pregnancy or not, how many times it should be done, are there any hazards of doing the ultrasound in pregnancy, whether x-rays can be done in pregnancy or not. Very soon I'll be uploading a video on this also. So the two tests for the diagnosis of pregnancy, we can see that the more easiest, the convenient and the cheapest test is urine pregnancy test. But for the confirmatory diagnosis, the most specific test is of course the ultrasound in pregnancy. So friends, this was all for today. We have discussed in detail about the earliest symptom of pregnancy and how to confirm your pregnancy. If you've liked this video, then do press on the thumbs up or the like button. Do share this valuable information with your friends and relatives so that it reaches out to the maximum number of people, and so it also gives a boost to our channel. And I'll keep on sharing such useful information with you in the forthcoming videos. Till then, what I say is stay healthy and stay happy. We'll be seeing you soon in the next video, and bye bye for now.